today, thank you, madam, for giving me this opportunity to speak about the very favorite topic of mine is adult and adolescent vaccination. So, before we start, just want short, sort of the silence or the meditation for these departed souls who has it's a big trauma for everyone, and many medical students also just passed away. So at least for the families we can just have the collaborative meditation to send the prayers to them. So Sister BK Shivani shared this yesterday, so I thought for at least for 1 week we should practice this. So if all agree, just can meditate, can send the prayers to all the
maybe also we can all chant Om for a minute.
Yeah,
that would be the best.
Yeah. I think that
you start. You start. We'll follow.
Go ahead. Yeah, thank you everyone. I think we should practice this every day for things, so to calmness of ourselves as well as to the nature. So vaccination in adolescents. So why is adolescent vaccination important in India? Definitely, basically because elsewhere, सब जगह पर जो है adult vaccination is well established program. If I talk about the Europe, I talk about the America, so they have the guidelines that every adolescent should be vaccinated. We have the very well established childhood program. So, and we know adolescents are vulnerable to the several vaccine preventable disease. Like you name anything, you name the cervical cancer, you name hepatitis B, hepatitis A, typhoid. So these all are the vaccine preventable disease, and our adolescents are most vulnerable population to getting these infections. So COVID time we cannot forget, and currently also the COVID is spreading around. But COVID at least did one good thing. It has made us realize the use and capability of the vaccine in our life. Immunization is one of the most effective public health intervention, reducing or eliminating the burden of many infectious diseases. This is a well-proven thing. You have the example of polio eradication, you have the example of plague eradication, and so many things. Adult-adolescent vaccination coverage remains low for most of the routinely recommended vaccines. Despite the availability of many adults, adolescent as well as the young population, as already Dr. Deepti told, it is from the 18 to 24 years or even the more, they remain unvaccinated due to lack of awareness or due to the misinformation. There is an urgent need to address the problem of adolescent immunization or adolescent. What is the coverage status of the adolescent vaccine in India? It's still suboptimal. HPV coverage is less than 20%, Tdap is less than 50%, and the many more. It's all very less. Except the child vaccination program. This is the national immunization schedule for the pediatric population. So, even a pentavalent vaccine protects against the 5 diseases: diphtheria, pertussis, tetanus, hepatitis B, hemophilia, influenza, Hib, which is given at the time of the within the early 5 years of the age. So we know all these pediatric. I will not go through the pediatric immunization program, but our focus is about the adolescent immunization program. So IAP recommended for the routine use of influenza, typhoid, hepatitis A, varicella, and HPV and Tdap vaccine. So there are guidelines available. There are things available in India as well as. Only thing what is lacking, it is the awareness. It is about what we are not doing or what we are not counseling to the parents or the adolescent. So this is at birth, 6 weeks, 10 weeks, 14 weeks, the BCG, OPV. This is the pediatric immunization program, which is important. But if you will go there, I mean, from the 4 to 6 year, from यहाँ से चीजें मिस होना शुरू हो जाती हैं. 18-19 मंथ तक सभी पेरेंट्स अपने बच्चों को सारे वैक्सीन लगवा देते हैं. And after that, I think things are missing. Even 10-12 years, I don't know anybody how many of have taken this Tdap vaccine, even which is a established vaccine. And what we talk about the HPV, that is definitely is still a great dilemma. So, which are the key recommended vaccine for the adolescent in India? So, vaccination for tweens, teens, and young adults. WHO define adolescent age between 10 to 19 years. या जो भी मैडम ने बताया 10 to 24 years as a youth. So key vaccination for adolescent crucial. Catch-up vaccines, measles, mumps, MMR, varicella, chickenpox, hepatitis A, B, polio, pneumococcal, if they did not get them in their childhood. Tdap, tetanus, diphtheria, and pertussis, a booster dose is recommended to maintain the immunity against these diseases. HPV, definitely, which is not a part of the pediatric program, but it is recommended for both boys and girls. Influenza, annual vaccination is recommended to protect against seasonal flu. Right now, also in the COVID time, we are just recommending कि flu vaccine सबको लगवाना चाहिए because there is no availability of the COVID vaccine as of now for the upgraded COVID vaccine. Meningococcal recommended for a specific group, for the endemic areas, for the students, many students who are traveling to the US or some part of the South America, they are just, it is must for them. Japanese encephalitis also. It is for the children who are going to the endemic area for study or etc. So why adolescent vaccination is important? It boosts immunity. Some vaccine administered during infancy, early childhood may need a booster. Cancer prevention, like HPV vaccine, which is a very important vaccine for both boys and girls. Public health, to protect the community by reducing the spread of infectious disease. College university requirement. I mean, India में अभी तक college और university के requirement बहुत specific नहीं है. But if children are going abroad, it is a must thing. Even they are asking for the immunity test also. There is a antibodies are available, are there in the body or not? So Indian scenario. In India, there are 243 million adolescents, which constitute 21% of the total population. I mean, India को young country कहा जाता है इसीलिए because we have the youth, lot of youth with us. So thousands of the adolescents die and thousands are hospitalized every year due to communicable disease that could have been prevented by the vaccination, especially the typhoid. Lot of typhoid is there. Vaccine coverage in adolescent is inadequate because in general, they have less contact with the physician than the younger children. Many lack access to the healthcare and opportunity to vaccinate are missed by the provider. Actually, the problem is there. Like we talked, the young girls are coming to the gynecologist. बच्चे going to the pediatrician. But 10 साल के बाद वो कहीं भी नहीं जाते हैं. They are not going anywhere. And there are lack of some, adolescents clinic also, which are not promoted well or which are not taken, taken good thing by the society as well as. So adolescent is a time for exploration, experimentation. They engage in high-risk activity that increase the risk of various infectious diseases such as hepatitis B, HPV, even hepatitis C, HIV, etc. So 3 important infections, Neisseria, meningitis, pertussis, and HPV, for which effective vaccination now is available, but less popular. So what are the catch-up vaccines? General principle, no restart, minimum interval between the 2 doses should be followed. Hepatitis A, 2 doses at 0 to 6 months. Hepatitis B, 3 doses at 0-1-6 months. Varicella, 2 doses, 1 to 2 months apart, and typhoid, single dose of typhoid conjugate vaccine. And it can be repeated every every 3 years. So what is hepatitis A? Routine vaccination for all children aged 12 to 23 months. बचपन में दिया जाता है, पर who has missed 2 doses 0 to 6 months. Long lasting or even the lifetime immunity it provides. Catch-up vaccination, जिनको नहीं लगा है 2 to 18 years, especially for the adolescent, who are at increased risk of acquiring hepatitis A, especially the students who are eating out, who are eating the street food, who are into the endemic areas, who are going for the studies to the endemic area, mess में खाना खाना है या कहीं भी. So they are at high risk of jaundice, जिसको हम बोलते हैं hepatitis A. Who travel internationally to endemic areas? Definitely for travel to the endemic area internationally, they just want this vaccine to be taken. Sorry. So 14 days prior to the expected exposure. Male adolescent who have sex with men, definitely they need. Who use illegal drugs, students, HIV positive people, chronic liver disease. And we have the 2 vaccines available with the name of BioVac A hybrids in India. So hepatitis B. Recent data which is showing that India registered 2.98 crore, more than 29 million hepatitis B cases. Definitely it is alarming scenario. Even it is the figure which is matching with the HIV, and we have a lot of co-infection also. This represents the second highest number of hepatitis B and C cases in the world after China. So hepatitis B is a significant cause of the chronic liver disease, liver cirrhosis, liver cancer, and viral hepatitis related deaths worldwide. Definitely, it is one of the biggest contributor of liver cancer. HBV is 50 to 100 times more infectious than HIV, which every time I'm telling. Hepatitis B is more contagious. After that, the hepatitis C, and HIV has the least contagious during even the needle-stick injuries. So, hepatitis B vaccine is a part of routine national immunization schedule in India. Adolescent catch-up schedule is 0, 1, and 6 months for everyone. Recommended to all healthcare workers, which is again the missing thing. 0 to 12 months or rapid protection with the booster at 1 year for maximum long-term protection. Now we are not talking about any boosters. Agar 3 doses hain, you can check your immunity, anti-HBs antibodies. If they are more than 10, even there is no need of the further vaccination. Only thing, when we need this vaccine again, if there is any immunocompromised condition in the body, like CKD, like AKD or HIV or anything. So we can again recheck the antibodies and we can give the booster. So we have the multiple vaccines available. Hepatitis Angerix B is now only available for the pediatric population, not for the adolescent. Genvac, BioVac V is mainly used. Typhoid in India. A prominent public health concern, typhoid. 2022 और 2024 का with a significant rise in cases, particularly during the monsoon season. So, cut foods, even in India, even the proper improper sanitization and improper water is leading cause of the typhoid. So WHO estimated there are 9 million cases of typhoid fever annually, resulting in about 1,10,000 deaths per year. 1,10,000. If somebody is dying with the typhoid, it is definitely a very, very risky thing. No one should die because of the typhoid. Typhoid caused by the bacterium Salmonella typhi is spread through contaminated food and water. So especially बहुत सारी colonies में, I remember I was just when I was a district TV officer in Karol Bagh, RK mission. So there was an area जहाँ पर वो पूरा IAS का सारे बच्चे जो IAS की तैयारी करते हैं. So it is a whole area. So lot of children were coming the typhoid, coming with the typhoid fever. बेसिकली बिकॉज उनके पास पानी बहुत खराब तरह का आता था और जो खाना वो खाते थे वो जो कुक्स दे आर मेकिंग सो दे आर ओनली ट्रांसमिटिंग दिस इन्फेक्शन टू दिस यंग एडोलेसेंट दे आर यंग चिल्ड्रन सो दिस इज ए वेरी वेरी अलार्मिंग थिंग सो वी शुड टेक केयर ऑफ दिस वैक्सीन एंड वैक्सीन जस्ट आई मीन टू टेक द लीड ओनली एडोलेसेंट की बात नहीं करती हूँ एवरी पर्सन हु इज कुकिंग इन योर किचन at your home, should take this vaccine because they are the one who are bringing the disease. और आप कितना भी हाथ धोकर बना लें, कितना भी आप सब्जियों को धो लें, बट अगर आपने उनको नहीं डिवॉर्म किया, उनको नहीं वैक्सीन लगाया, तो वो आपकी किचन में और आपके बच्चों को और आपको लेकर डिजीज आते हैं. So typhoid vaccine is recommended to all the travelers to the India, even if visitors only urban areas. The single shot vaccine offers approximately 70% protection. Typhoid booster vaccine are generally recommended every 2 to 3 years. और ब्रांड हमारे पास टिब्बार आता है, Zyvac TCV आता है, TCV और Typhovac. So we have the plenty of the companies who are making these vaccines. Polio vaccine, we know polio has been eradicated most part of the world, but reducing the number of cases reported each year. Polio elimination in America by 1994. India declared a polio-free country in 2014, but few cases still we have seen कि इंडिया में आ रहे हैं. अफगानिस्तान एंड पाकिस्तान are the few endemic countries जहां पर कि अभी पोलियो eradicate नहीं हुआ. India need proof of the OPV, IPV vaccination received between 4 weeks to 12 months before departure from the travelers from the Afghanistan, Pakistan, Syria, Congo, Ethiopia, Kenya, Nigeria on arrival. India utilized a combination of OPV at early stage, but we have the now IPV also. So pulse polio days, OPV for all children between 6 to 59 months. Catch-up vaccine is required if they have missed the dose. MMR vaccine is a live vaccine. So we should give it with the care. Basically, because this is the only live vaccine, or most of the vaccine, we have the conjugated vaccine. So 2 doses at least 4 weeks apart. After 2 doses, 97% people are protected against measles, 88% against mumps, and 70% against rubella. Catch-up vaccination recommended for those who are not immune with well-controlled HIV/AIDS. Especially, I am not using it for my HIV patients, basically because it's a live vaccine, and when immunity is less, so we cannot give. So if the CD4 is more than 350, we can easily give. Within 72 hours of the exposure to the measles, who are incompletely immunized, all the contacts. So pneumococcal vaccine. It is not for all the adolescents because pneumococcal vaccine that we are giving in the childhood, but the specific in India, we have the vaccine which is 2 type of the vaccine, PCV13, which is with the name of the Prevnar, and PPSV23, pneumococcal 23 vaccine. So we have 2 vaccines available. Prevnar 13, rather even the 15 is recommended for the children less than 2 years, and adults, Prevnar 13 is recommended for more than 50 years. PPSV 23 for adults more than 65 years. And we have the age group, special conditions, which is 19 to 64 years. If the person is immunocompromised, 1, if person is having COPD, 2, if the person is having any cardiac ailment, even the children, adolescent, even if they have any transplant. So they are in the group which can be taken these vaccines. I mean, जिनको हमें ये vaccine देना है. Tdap, I already told in initial say, it is controlling the Tdap, tetanus, diphtheria, toxoid, and acellular pertussis. So in India, there are notable research of the diphtheria cases in 2024, particularly in Odisha. According to the National Health Profile 2022, India has reported 1586 cases and 22 deaths due to diphtheria in year 2020, and 3,677 cases and 47 deaths in 2021. So it is still roaming around. Diphtheria is and ये भी अब diphtheria और pertussis ऐसी disease नहीं है जिसको पहले कहा था सिर्फ बच्चों में होती है. We have seen the adults also coming with this whooping cough, etc. So pertussis cases also increased significantly with the 30% rise reported in the media. Tetanus, while declining in many countries, is still present in India. Immunization coverage has experienced a shift of diphtheria cases towards older children and adolescents. जहां तक टेटनस की बात है, टेटनस तो मोस्ट अब्यूज्ड वैक्सीन है, सबसे सस्ता वैक्सीन है. जहां किसी को छोटी सी सुई भी चुभी, दुकान से जाएगा, खरीदेगा और लगाएगा. बट दिस इज नॉट ऑफ एनी यूज इफ द कोल्ड चेन इज नॉट मेंटेन. जितने भी पेशेंट मेरे पास भी आते हैं कि वो एक वायल लेके आते हैं, जेब में रखकर, पूरा गर्म वायल होता है. इवन द मोस्ट ऑफ द फ्रिज आर नॉट वर्किंग इन द medical shops, and they are bringing and they are taking this vaccine. So please counsel them that this is of not any use. they should take the booster, like adolescent, 1 dose at 10 to 12 years, TD, booster every 10 years. Then after that, they don't need the every week or every month, kuch bhi chubne se, unless only exception is the road traffic accident. रोड ट्रैफिक एक्सीडेंट अगर हुआ है तो किसी को कभी भी टीडी लगाओ, उसको जरूर देना है. बट स्मॉल कट्स और छोटे मोटे जो घर की सुइयां और चाकू से हाथ कटता है, उसके लिए इट इज नॉट रिक्वायर्ड. HPV vaccine now includes in India's universal immunization. So we will talk about the HPV. HPV vaccination now includes in India's universal immunization program. Yes, it is. From 2024, HPV vaccine has been included for the girls aged 9 to 14 years in a phased manner, which is like, I think, a big role goes to Dr. Sharda Jain and the many senior people who are just keep on fighting since ages for this vaccine to be rolled out in a universal immunization program. So HPV vaccine marketed in India and FOXI, good clinical practice recommendation. Bivalent, we have the 3 type of the vaccine. You all are gynecologists, you know much better than me. 3 type of vaccine. Abhi jo Indian made hai, Cervavac, cheapest hai. Recommendation is 9 to 26 years for male and female both. Gardasil, which is quadrivalent, which is available in India, 9 to 14 years we can give. And Gardasil 9 nanovalent vaccine by MSD. And it is again for the females 9 to 45 years and males 9 to 15 years. Even the 9 to 15 years, only 2 doses can be given. 9 to 14 years, at least 6 months apart. And 3 doses about 15 to 26 years, 0, 1, 2 months or 0, 2 and 6 months. 3 doses for older women till 45 years. So these are the recommendations. And even the boys, we were just talking ki council the boys also. So here also we are just talking ki council give this vaccine to the boys also. They are the carrier for this HPV virus. Although HPV disease man में female के comparison में कम होती है, but अगर हम vulval cancer और अगर मैं penile cancer का figure देखूं तो वो करीब बराबर है. Except I'm not talking about the cervical cancer. But cervical cancer is the most common, like second largest population we are having. And breast cancer के बाद सबसे ज़्यादा cervical cancer से deaths होती हैं. So, but vulval cancer, and in men, it is creating the penile cancer, oropharyngeal cancer, and anal cancer. And now we are having the lot of population who are behaving as the MSM or the bisexual. So it is then most important vaccine again. Can boys also receive the HPV vaccine? Yes. Although current national routine rollout prioritize girls, global studies show the benefit for the boys in preventing genital warts and oropharyngeal cancer, penile cancer, and even the anal cancer. Influenza vaccine, annual vaccine. So it is recommended for all. Minimum age 6 months for inactivated influenza vaccine, recommended for all children 6 months to 5 years, 6 years to 18 years, only high risk groups. I mean, it is recommended for the high risk group, but now we are just giving, most of the people are coming ki nahi hame influenza vaccine laga do after the COVID has spread. So these are the, but high risk group, definitely the cardiac, respiratory, renal, liver disease, HIV, diabetes mellitus, lab personnel, healthcare professional, they should take it for sure. Adults 65 years and older, pregnant women should take this vaccine because it is preventing the women as well as the newborn child. So nasal spray recommended only for the healthy children 2 to 18 years. Nowadays we are not much using the nasal spray. Best time is pre-monsoon period, May to June, with the latest available strain. Every year strain is changing, and now we have the 2 strain, northern hemisphere, southern hemisphere. So now even it is the recommendations are coming to give it to the twice a year, but at least once in a year if you are taking, so that is a good thing. Meningococcal vaccine, I told it is for the special population who are going to the endemic area. So it protects against the highly contagious meningococcal meningitis, septicemia caused by the Neisseria meningitis. In India, disease usually involves young children, have a low incidence except for the periodic outbreak in North India, which is coming every year, I think. Not a routine vaccination in India, type of vaccines, meningococcal conjugate vaccine, which protects against 4 types of meningococcal bacteria, and meningococcal polysaccharide vaccine, which is less preferred. Basically, if we are just giving to the students, we are giving the meningococcal conjugate vaccine. IAP recommends MCV4 for immunocompromised children, HIV, absent or non-functional spleen, people working in labs, children and adults traveling to the certain part of the Africa, young adults traveling to the USA for further studies, pilgrims, for the Hajj people, definitely it is very important. Dose is scheduled 9 months to 2 years, 2 doses 0 to 3 months apart. So these are the IAP guidelines, IAP chart for the immunization practices, which is well available everywhere. And this is the CDC chart recommended in the United States. So this is even the COVID vaccine, influenza vaccine, this is the age-wise chart which is recommended, and they have a special recommendations also. And especially when we are just giving this. So all the vaccine, COVID-19, influenza, tetanus, Tdap, measles, MMR, varicella, zoster vaccine, even human papilloma virus, pneumococcal, hepatitis A, hepatitis B, meningococcal B, and Hib vaccine. All vaccines have the recommendation, but the adolescents, I told already, the HPV, hepatitis B, hepatitis A, typhoid, and the influenza. These are the important vaccines which they should varicella, and this is MMR also. So I think this, if we should take it up, and we should talk to the adolescent, and we should, if we will just, everyone will talk, then definitely we will have the more coverage of the adolescent immunization.